Learning anatomy requires a lot of memorization. We have over 600 muscles in the human body, and learning the names and locations of those can be overwhelming. And that's just one body system. So it's important that we learn how to use common terminology, which will make it easier for us to memorize the large chunk of anatomical terminology. Why use medical terminology? We've discussed this in the previous video. Assume a patient comes to you and complains of chest pain and is diagnosed with pericarditis. Pericarditis. What do you think this word means? Words like this can be intimidating, but the goal of medical terminology is to communicate effectively, reduce misunderstandings, use a universal language that describes diseases and procedures precisely. So we will be learning how to decode medical terminology. So how are medical words built? Medical words are like Lego. They follow simple rules and anyone can learn them. So we need to know what prefixes, suffixes, and roots mean because these are the words that are used, that are combined to form medical terminology. So what is a prefix? A prefix comes at the beginning of a word, a medical terminology, and it describes direction, location, number, or amount of something. Root word is the middle word, and that's the subject. It relates to your body part or the system that we are addressing. And suffix is the ending of that medical term, and it means a condition, a disease, a process, a specialty, or a test. Now let's look at an example. Now, peri is a prefix. Now, what does peri mean? It means around, right? Card refers to the heart. It's a root word. It's the middle word. And itis refers to inflammation. It comes at the end, and therefore it's the suffix. Now, if you put this together, we come up with a word pericarditis. So if you break it apart, you have peri, card, and itis. Reveal one piece at a time, and that'll give you the meaning of this terminology, which simply means inflammation around the heart. Now let's look at each of these terms, root word, the prefixes, and the suffixes, and learn some common terminology that comes under each category. So we know what the root word means. It's the middle word. That it's the basic meaning of a medical term. It refers to the body part or to the body system. And root words are combined with prefixes and suffixes to create new medical terms and give meaning to those medical terminology. And these words are generally combined with a vowel like O to a suffix or to another root word. Let's look at an example. So we have this example, gastroscopy. So gast refers to stomach. Scopy refers to examination using a scope. And therefore scopy, since it's coming at the end, it's the suffix. Gastro is the root word because it's talking about a body part, about the stomach. And we relate this with a vowel like, which is usually O. So gastroscopy is simply examination of the stomach using a scope. I hope this is easy. So this table gives you some common root words and their meanings. So we have cardio referring to the heart, gastro refers to the stomach, entro refers to the intestine, hepato means the liver, neuro means the nerve, derm or cutane refers to the skin, osteo refers to the bone, arthro, joint, cranio refers to the skull, pulmo refers to the lung, and cyto refers to the cell. So if you know these common terminology, there's more, but I've just made up a table with some very commonly used root words, and that should help you break down and decode medical terms. Now let's look at suffixes. What's a suffix? We know that comes at the end of a medical term, and it is combined with a root word and sometimes a prefix as well. So prefix may or may not be there. like you saw in the previous example, gastroscopy did not have a prefix, it just had a root word and a suffix. A suffix usually describes a procedure, a condition, disease, a specialty, or a disorder, and it cannot stand alone. So it has to be combined with a root word in order to give it a meaning. Let's look at an example. Carditis. So we know what card means. Cardio or card refers to the heart. It's the root word because it's giving us the location. Itis is the suffix, all right? And itis refers to inflammation. So what does carditis mean? It simply means inflammation of the heart. So you see how easy that is. And this table gives us some common suffixes that you would come across anatomical terminology when you're learning anatomical terminology. So AC, AL, ARY, IC, ICAL, and EAL. If you see this as the suffix of any medical terminology, it simply means pertaining to. Itis, we just learned, means inflammation. Algia refers to pain. Ectomy refers to surgical removal of some part of the body. Okay. So, and then we have scopy, visual examination. We just saw that. Then you have logy, study of. Likewise, you see OMA refers to tumor, pathy refers to disease, gram refers to record, graph is simply an instrument used for recording, graphy refers to a recording process, megaly refers to enlargement, and then ossus refers to a condition, plasty means surgical repair, like say rhinoplasty, for example. Okay, so it's a surgical repair of the nose. Rhino refers to the nose. So suffixes are found at the end and they don't stand alone. They tell us what's happening to that body part. Lastly, prefixes. So what's a prefix? A prefix, remember, comes first. It's a word that's added at the beginning of a medical term. They modify the meaning of that term. They cannot stand alone. They need to be combined to the root word because root words are the essence. Prefixes usually describe the location, the direction, the numbers, or the amount. Let's take an example again. Tachycardia. So break apart this word. Tachy. What does tachy mean? Tachy simply refers to fast. It's not referring to any body part, so therefore you clearly see that it's a prefix. Okay, so tachy refers to fast and it's a prefix. Cardio, we know by now, refers to the heart. And IA refers to a condition. So IA here is the suffix tachycardia. So therefore, tachycardia simply means a condition of a fast heart. So I hope you're getting this right. So we can clearly see how breaking apart a medical term, decoding the medical term will help you simplify and to get to the meaning of that word rather than simply memorizing that terminology. So this table here summarizes prefixes based on location. So anti, we know what anterior means, in front of. Retro simply means behind something. Endo or intra refers to inside. Exo or extra refers to outside. Hypo is below or under something. Hyper is above. Infra or sub refers to below or underneath. Uh, then epi or supra refers to above, on, or over. Inter is something that you call that's between something. Peri is around. Brady refers to slow. Tachy refers to fast. So you can clearly see that these are pairs of words. Most of them exist as pairs of words. So it's going to be easy for you to remember these. As you see here, learning them up might be a little easier when you look at it as pairs of words. And trans here refers to across or through. So that's based on location. Based on numbers, prefixes can either be semi or hemi, which means half. Mono or uni refers to single. Bi or di refers to double. Tri refers to three. And quad refers to four. Now, let's just break down some common medical terms. I want you to pause the video so you can try breaking this down like the way we just learned. Remember, do not memorize entire words. just try breaking them apart. Don't guess them. It's always better for you to learn up that table first for each of those roots, prefixes, and suffixes, and then finally decode each section. So what's an electrocardiogram? If you see here, if you break it down, electro refers to electricity, cardio refers to the heart, and gram refers to record. It means record. So the meaning of this term is simply a recording of the heart's electrical activity, in other words, ECG. All right, so you see how simplified it gets if you decode medical terminology. So let's look at a last one here. Rhinoplasty. Rhino refers to the nose. Plasty is a surgical procedure or a repair or a reconstruction. So what does it mean? Put together, it means surgical repair or reshaping of the nose, all right, commonly called the nose job. Another example here, hepatitis. Hepat simply refers to the liver, and itis we know is inflammation. So what does hepatitis mean? Inflammation of the liver. All right. Now let's put this medical terminology into practice. Suppose you have a question like this on the exam. So you have, say, this question that says the suffix itis means inflammation. Which of the following terms means inflammation of the membrane lining the body cavity that contains the liver and the stomach? We know the liver and the stomach are in the abdominal region, right? And the membrane of the abdominal body cavity is called peritoneum. All right, it's called the peritoneum. So inflammation of the peritoneum, what do you think that would be called? Is it pericarditis? We know card refers to the heart, so it's definitely not this. Peritonitis. We definitely see here that the answer here is peritonitis. Itis here refers to inflammation. Peritoneum is simply the membrane of the abdominal body cavity. So this is how you break down the word to get to its meaning. One last example. Using what you know of medical terminology, which of the following best describes a trans-esophageal echocardiogram? Is there a visual record of the heart taken by an instrument within the esophagus? Pictures of the lungs taken by means of an instrument within the esophagus, using the heartbeat to measure the size of the esophagus, moving a tube through the esophagus and into the heart. Now, you might think this choice and this choice are quite close because they both, and even this for that matter, talks about the heart and the esophagus. But then it's always best to break this word down first, this terminology first. So what does trans refer to? We know trans from that table. If you get back to that table, trans means through or across. EAL, esophagus, esophag refers to the esophagus, we know that. EAL simply means pertaining to, all right? Then echo refers to the sound. Card refers to the heart. And gram means a record. So what does all of this finally mean? It simply means a visual record of the heart taken via an instrument within the esophagus. Why is it within the esophagus? Because we're saying trans, right? So that's all for today's lesson. And I hope you enjoyed it. I hope you understood this. Thank you for watching.